Okay, so I'm recording these sessions. And we looked at osteoarthritis on Thursday. So let me just, okay, oops. Pardon me 1 second. Okay, I'll just leave my little pencil, that's fine. See if that, oh, that clears it, okay. So I wanted to continue with musculoskeletal because since none of you have given me any requests, which is fine. And I wanted to look at rheumatoid arthritis. Now, remember when we work, and I'm teaching you what I have found with these various conditions, we always want to think about with that additional testing and review is what tissue is breaking down and what nutrient can be or should be applied to that specific tissue. So it's very important. And with rheumatoid arthritis, of course, we know that this is a terrible autoimmune condition that can affect not just the joints, as it says here. I can send this to you if you want it. I'm not going to read the whole thing. It describes it because I mainly, it can affect more than the joints of the body, for sure. And it's a very debilitating condition. And if any of you have had rheumatoid arthritis clients, you know that their struggle is intense. I put rheumatoid arthritis in the similar category of MS, Crohn's, even cancer. It's a very debilitating condition. And the medical view and medical approach, of course, is steroids, other medications, such as Rituxan, which is widely used for rheumatoid arthritis, Rituxan, which does work. It's a pretty safe medication, believe it or not. Surprising that I would say that, but it does work. And it helps to modulate B cell activity. So the immune effect of rheumatoid arthritis centers around either the production of B cells or the inability for the body to eliminate so many of the B cells. Now, when you think of B cells, write this in your notes. You must think of the main producer of those B cells, of course, the bone marrow, but the spleen. So now, the body has obviously misinterpreted, and the body, with this overproduction of these B cells, the necrotic tissue has leaked from some area of the body, and I'm going to go into that right here. Then the immune system has cleaned that up, creates antibodies, and then, as the principle of all autoimmune disease, then the body begins to attack that host organ. And that is the key to understanding. And of course, the autoimmune disease or effect is a downstream reaction. It's a downstream occurrence after the tissues have broken down sufficiently and, again, leaked into the blood, those necrotic, and the body sees it as antigens. There's different types of antigens. There's 3 that I could find. One antigen is on the surface area of viruses, interestingly enough. So you have this effect, which other teachers can teach you, that I don't want to go into that. I want to go more deeply into this. So, because we have to know if we're going to apply nutrition, what are we working with? Okay. RA is a chronic inflammatory autoimmune disease that affects the joints, and even disease that is affecting other organs of the body. This is due to inflammation, excuse me, inflammation of synovial lining. So for some reason, this lining, those necrotic, usually they're protein cells, are leaking into the blood, and it's causing this reaction. Membrane lining of the joints. This can cause this in the synovial, well, let me just read the rest of this. This can cause the disease's characteristic swelling, pain, limited range of motion, and decreased function, but also joint damage and deformity as the synovium begins to thicken, and inflamed cells release enzymes that digest bone and cartilage. This is a very severe condition. It creates joint damage, and it's usually bilateral. So if it happens in the hands, one hand, it will happen in the other. The knees, the other. But it is this synovial pattern that I wanted to read first, so that we're thinking of not only the joint, but what part is actually leaking into and why it's doing that. So there is that. And the other thing I wanted to read to you was this on the synovium itself. The synovium, also called the synovial membrane, is the soft tissue that lines the spaces of diaphragmal joints, tendons, sheaths, and bursae, bursa, like bursa sacs, which is part of the joint, especially the shoulder, but there's bursa sacs in the knees, wrists. The synovium lines the entire inner surface of the joint, except where the joint is lined with cartilage. The synovium has an outer layer and an inner layer. The cells of the are called synovial sites. There are two types. I'm not going to go into that. The subtena consists of intra-articular with the joint vessels, such as blood vessels and lymphatic vessels and nerves. Underneath the layer of the synoviocytes, there is either adipose tissue or fibrous tissue. So that gives you a bit of a feel for what is actually going on here. What is being damaged? Why are these cells leaking into the bloodstream, creating this terrible autoimmune condition? The synovium, where synovial fluid is produced, the substance that lubricates and nourishes cartilage and bones inside the joint capsule. So you can read more about this if you want. I can send you these. So let's get to my protocol in the book. And I'll just find it here. Here it is. And it's on page 303. So when I, Now there's an index in the back of the book, which I already looked it up. And so let's think about what Dr. Lee said first. Now, not all the protocols have quotes, but a lot of them do, and a lot of them are from my teachers or concepts or hypotheses that I have learned in my almost 50 years. The various degenerative diseases thought to be due to antibody excess are all those in which no reasonable etiological cause has otherwise been found. Now remember, he wrote this 70 years ago. Normally, a healthy endocrine system protects us from these eventualities. There is the key. And here is the key to rheumatoid arthritis, that because rheumatoid arthritis is so global, it can affect not just the joints, but other tissues as well. And it is such a severe inflammatory, the inflammation like never quits. And Lee nails it here. He says, it is because of this endocrine, this lack of communication throughout the body. And what is the key to all communication throughout the body? It's the endocrine system. Now, in the very last page of the book, there's an article that describes this, that goes back to 1918, Sir Robert McGarrison, who was actually knighted for his work in the nutritional field back then. He said, Sir Robert McGarrison demonstrated in 1918 that the first effect of refined foods is to destroy the function of our endocrine glands. So we think of refined foods, what do? Well, you get blood sugar issues, and you get, you just get malnourished. You can get inflammation. But the first effect, which we don't tend to think of, is the endocrine glands, with the thymus, adrenal, and pituitary among the first to be damaged. There you have it. And let's just look at these glands. So the thymus plays a key part in immune regulation, okay? The adrenal for inflammatory processes. And of course, the master gland that has an influence on not just the digestion, not just the musculoskeletal system, but the heart and the nervous system in particular, a lot of other things, and all of the other endocrine glands. So here you see this combination of what McGarrison was saying and Dr. Lee was saying, that here lies really the issue. Now, what I did was also consider, I didn't have enough room to put up, to make it a fourth, because these other fours initially, these other four products are of primary importance to balance the immune system out, to stop the immune assault, and to reduce inflammation. But eventually, or if a person was willing to do a fifth product, you would use Simplex F, pituitary, thyroid, adrenal, and ovarian. In the male, pituitary, thyroid, adrenal, and testicular. Because here is the key. Now you could say, well, Joe, we didn't address the thymus. He talked about the thymus. It is addressed in Immuplex. And bone marrow, and spleen, and liver. I'll get to Immuplex in a minute. So make sure in your notes that, yes, these are the 4 primary to begin with products to be applied. But certainly if the client is willing to add in either simplex F or M. Now, you could say that, well, Joe, what about Paraplex? I've talked about it. A lot of you are using it. You like that product. Yes, and that is pituitary, thyroid, pancreas, and adrenal. But the gonads, which is in the gonadal protomorphogen, that's either in the simplex F or M, is the partner. It's the dance partner to the pituitary. And that's why I chose this one. Certainly you could write in Paraplex if the person, part of what they're dealing with is a blood sugar issue. And that does tie in with inflammatory processes, yes. But the reason Lee made these 2 for male and female is specifically because of that relationship between the pituitary and the adrenals. These are very important products. And if you were my client over the years, fill out a symptom survey form. I started everyone on either simplex F or simplex M, male or female. Because I knew this principle. I knew the fact that I want to assist that person with as much communication as possible, starting with the endocrine system. No, not the nervous system. No, not the digestive system. Those all come after, and they are important, but you have to start with the endocrine system first. It's a key principle. McHarrison knew it. He saw it in the work he was doing with the people in India. And that's a wonderful story that we could discuss at some point. So, to stop the immune assault on any organ, gland, or tissue, as you know, you must use the protomorphogen. So what did Dr. Lee say about ostrophin? And let me just get it here. I thought I had that out. What is that? Anyway, let me just look it up real quick. So we have to get back to what he was thinking about the implications of these different protomorphogens. 133. Okay. So to stop that assault on that particular tissue. Now, I started with that synovial pattern, yes, but if you were using the ostrophin and you said, Joe, I'm doing this high dose at 3 twice a day, it's a pretty high dose, or even you went higher at 3 times a day with rheumatoid arthritis, because I can tell you, I've had in my career about 6 rheumatoid arthritis cases that I've worked with, and they are tough. And the person, like with cancer or Crohn's or MS, really has to live pretty much a perfect lifestyle with what they eat, how they rest, and to regain that balance in their system. And using ostrophin 3 times a day, obviously we always use it on an empty stomach. So when would you use it? Well, you'd use it an hour before lunch is probably the best time. So upon arising, 3 more at 10. 10 o'clock is a good time. Say they eat at 12, and then again before bed, empty stomach. So if people are willing to comply. Because we have to remove the burden on that tissue if that tissue is to regain its balance. So what did Lee say? the clinical signs and symptoms: bone and joint syndromes, arthritis, joint pain, ligamentous problems, pain in bones, connective tissue, ostrophin. He says connective tissue, supportive tissue as irritated gums, loose teeth, receding gums, calcium utilization, osteoporosis, rheumatoid arthritis, osteomyelitis, and circulation symptoms, headaches, ostrophin. Am I on the right page here, everyone? Yes. And that's why this book from Saline River Press is the book I always go to, always. The product bulletins, Saline River Press. One of the best books you'll ever buy. I look at this book every day. Of course, I look at my book. What was I thinking when I wrote this back? I can't remember all the protocols pretty much by heart, but I can't always remember the finite. Here it is. Circulation symptoms, headaches, varicose veins, hemorrhoids, venous congestion. And then he goes into a couple other things related to, but the main thing that he says is what we discussed with any musculoskeletal disorder, is the enzyme phosphatase. He said it's mainly found in growing bone, but certainly ostrophin, calcifood, which is on here as well, Biodent, Biost, any of those products are very high in phosphatase. And you cannot regulate bone and joint integrity without that enzyme. It's destroyed. If you look up one of the things you should not have with rheumatoid arthritis, it's milk, it's dairy. It's forbidden, but not raw. It's the pasteurization process that makes that an inflammatory food. So very important. And Dr. Lee, of course, his foresight into dealing with autoimmune implications still is true today, since the time he started. The second most important product is to talk about Immuplex, because the immune alliance, there really isn't an immune system. The immune alliance relates to thymus, spleen, liver, and of course bone marrow. And I'm not going to break this product down, but this is really, if you're working with any immune condition at all. And by the way, this is the time of the year that I switch over from Catalin to Immuplex. Remember, I do 6 months with Catalin. Now I get my Catalin through Syrofood, which is, Syrofood is half Catalin powder and half calcifood powder every day. And then I switch over. I still take that, by the way, but I add in the Immuplex now, once the first snow comes. That's how I gear it. And many implications to not just what's going on around the country with the viruses right now, but any bacterial or virus infections. The stability and the ability to handle is key, which is 3 twice a day. And again, empty stomach, because there's not only cytosol, spleen, and thymus cytosol extracts in here, there's also protomorphogens. This was well put together. This was put together, formulated by John Courtney and his team at that time after Lee passed away. It was one of the first products John formulated after Lee's passing. So why do I have Boswellia? Because we have to, when working with a condition that inflammation is such a problem, we have to use anti-inflammatories. What do they use medically? What does medical science use? Well, they use steroids or some form of steroids, which lowers the immune system too much. We want to regulate. We don't want to lower it. We want to distract it, and we want to regulate it. We don't want the immune system going too low. We don't want it going too high. So here it is. And the Boswellia complex, of course, Boswellia is one of the oldest anti-inflammatories known to us that is well used. Gold, frankincense, and myrrh, it's part of that frankincense family. And in my opinion, is the best anti-inflammatory that we have available to us. But you can't just take a couple a day. This is something that we have to realize that we have to work based on the clinical dose that's accurate for that client. Don't use muscle testing. Just go by take a page from my book. Just try 2 to 3 times a day, every 3 to 4 hours. Because if you muscle test and you see, oh, it's just, I'll just use 1 twice a day or 1 3 times a day, then it doesn't help the person. Then you say, well, the product didn't work. No, the product works if you get the dosage correct. Now, in Boswellia, of course, there's the Boswellia. There's celery seed. I'm not going to go into too detail, but celery seed is huge as an anti-inflammatory. So is ginger, which is in here. And of course, a lot of you now for anti-inflammatories are using the turmeric forte. That could be another one. Write that in your notes. I have not, with some people it works, but again, I have given you in this book the 90%. This Boswellia has never failed me, Boswellia complex. It at least reduces pain and inflammation in half, at least. And there's no limit to how much you can take. You're not going to overdose a person. The other one that I've had, I have so many stories with this particular herbal combination. And as you know, I'm not a huge on herbs, but I do use them. And especially when you need herbal medicine, you need something strong in the initial stages. And Romania complex has been, I literally with Romania complex and this glucosamine synergy, after I've used the Oligoplex 1 as a maintenance, I've gotten so many elderly people with joint pain and inflammation off their meds. Dozens with Romania complex and glucosamine synergy, which again, I'm not going to go into. You can look that up online and see, it has the glucosamine, it has more Boswellia, and it has the Oligoplex 2 in it. But it's still a great product. But this is a key product. So what is in Romania? Well, Romania itself, the herb, is the queen of herbs for the kidneys. The queen of herbs for the kidneys. Now, whenever you think of inflammation, what do we think of? We think of, oh, we need adrenal support. Yeah, true. But what is the partner to the adrenals? Much more significant. If you go into Eastern culture, the adrenals are just a part of the kidney chi. They're not the main part. And so Romania is a key herb for that. Not only for energy, helping to support the adrenal kidney to reduce inflammation, and a lot of other things. But in Romania complex, there's also bupleurum. And again, bupleurum is specifically for acts as a liver protector and anti-inflammatory. And also in this formulation is feverfew. Feverfew is known for, at higher dosages, migraine headaches, and guess what? Rheumatoid arthritis. It's specific for that. And that's what's in the Romania complex. That's why I've used it and I have it in my top 4. And of course, the last is Hemi Desmond. Hemi Desmond is the strongest immune modulator in the herbal kingdom. And that's why, as I say, especially the elderly that just have that, that osteoarthritic joints, they swell up, which is true of rheumatoid too. It really helps with modulation. And 2 twice a day. So they're not huge amounts of these products. Now, maybe after a while, you could get away with just 2 twice a day of the Boswellia as well. So there is your core. Now, of course, you want to add in the simplex F or M. Now, I'm briefly going to go over these also consider. And then I have something to finish with related to the synovial, this synovial piece. We talked about calcifood twice last week. I have a great article on calcifood. If you want it, I'll send it to you. It was written by Dr. Lee, and you can read about it. But remember, you can reduce the inflammation. You can assuage the immune system, help regulate it. But eventually, you have to feed that tissue. There's nothing better on this planet to feed bone, joint, ligament tissue, discs, calcifood. Things that help, but the raw materials in this bone meal flour is, I can't say enough words about it. And how many people I've helped with osteopenia, osteoporosis, osteoarthritis, and rheumatoid arthritis with this. There's always with joints, you always want to think about the mineral manganese. And again, what is the vitamin that goes with that mineral? Vitamin E. Oh, it's in Ligaplex 1. And what is the glandular, the light glandular for that vitamin and mineral? Pituitary. Here it goes back to what we started with Dr. Lee and Dr. McGarrison, the pituitary. I talked a lot about Gotu-Kola, healing collagen, helping to bring new tissue in, which is a great complement to calcifood. You know how many discs I've helped in people using the combination of Gotu-Kola and calcifood? Hundreds. Now with my book, probably thousands. Now you could say, well, Joe, they can't take all of this. You said 4 and this one is 5. Okay. But you could always rotate these in at some point. And you won't need to continue unless especially if the person is eating correctly. And listen, people with rheumatoid arthritis have to stay on the straight and narrow. The paleo diet is best. The least amount of inflammatory foods. They can't get away with it. You could say, well, once or twice a week, no, they can't, because then they suffer for days. They know when they have fallen off the wagon, believe me. Just, if you have this, you have to deal with it in an accurate way. And of course, the reason I put Livco in is because people that have rheumatoid arthritis are on so many drugs, anti-inflammatory, and the other Rituxan, and we have to give them something that helps with the clearance of those drugs. Otherwise, what's it going to do? It's going to increase the rheumatism. It's going to increase the rheumatoid effect. Toxicity is a big factor with it because there's so much cellular death going on. And so here is the best: silymarin, milk thistle, and schizandra, and the one other herb I can't think of off the top of my head, you all might remember, which is, again, is a liver protector.
Rosemary.
Rosemary, thank you. Thank you. Yes, here it is. So this is the protocol. Now, I want to go into this just to finish. How am I doing for time? Whoa, okay. All right. Oh, no, I don't want to do that. I want to go, where am I here? Oh, I want to go here. Okay, so I want to show you one other thing. Now, when we talk about this synovial piece, which is really in rheumatoid arthritis, that's the tissue that's being destroyed. That's the tissue specifically. It is joint. It might be other parts of the joint as well, maybe the ligaments. But according to what I just read to you, the synovial piece is huge. Now, why does that happen? And it happens, I'm just looking for this. Hold on one second. Where is this here? Let me just see. Oh, here it is. Sorry. This was part of, by the way, this is part of my advanced training with the HSR. So because I was talking about Cataplex E2, which we're not going to go into today. So over the years, I've used Dr. Lee's principles applied to other conditions successfully. And one of the key factors is in the product Orchex. And it's the first product in Orchex. I don't have that listed. And it's the first product or food source, the orchic extract. Now there's an enzyme, and I can send you this too if you want it, and it explains what I'm telling you now. It's the enzyme hydronitase. Now on the HSR webinars, I've explained this several times. This is an enzyme that largely occurs in testicular tissue. This enzyme is at the tip of the sperm, so it can enter, it spreads the ovum. This enzyme is known as the spreading factor, but does it just work in conception? No, it works in any fluid in the body. I've used it on people's eyes with glaucoma. Just had a case. And they said her eyes would never get better. They're better. Now, we used other things, of course, but this principle spreads out anything. This enzyme spreads, and it does spread synovial fluid. Well, what did we read when I first began? This fluid gets very thick and creates this very, very tight pattern in the tissue. So the tissue cannot function normally. So here it is. So this is a product you need to write into your notes, because rheumatoid arthritis is a condition that you will be challenged with for as long as that patient sticks with you. So you need other factors. Now you could say, well, Joe, if the synovial, if the synovium, this tissue caused by the thickening of the fluid, can we use, what do we use for a protomorphogen? Well, I read to you ostrophin, the range that Dr. Lee used that for. But there's another protomorphogen that you can use, and write this in your notes, spleen PMG. I couldn't write all of this into my protocols, but this is going now deeper into this so that you realize that you always have other tools you can use. There's always another answer. There's always something else that can be done. We cannot give up on people. Rheumatoid arthritis is a condition of the individual that is always looking back. They're never looking forward. They're stuck in the past. And they are literally, as the story in the Bible of Lot's wife, they're literally turning to a pillar of salt. And you could say, well, well, we're not, we're not therapists. I know, but we can still offer people substances that help them to relax. And this is the key product. Maybe they have rheumatoid arthritis and they have high blood pressure. Dr. Lee used this specifically for high blood pressure. Or they're just in so much pain, their nerve synapses, they're on opioids, their nerve synapses are firing off. Well, here's the nerve synapse. And again, that enzyme, hydronidase, spreads out the congested neurotransmitters in 1,000 trillion nerve synapses throughout the body, 100 trillion in the brain alone. Here it is. This one simple little substance. You could say, Joe, this almost sounds too simple, but it works. It works. And it's a tremendous go-to product in the course after you've helped the body get the immune system under control and the inflammation under control. Then we need to go deeper. And so the spleen PMG and the Orchex. Now the Orchex, again, how long does it stay in your system? Well, we say 3 twice a day is the usual dosage. Spleen PMG is 3 twice a day on an empty stomach. That's good. And remember, does it hurt to have 2 protomorphogens working on the same issue? Maybe you would use the ostrophin and the spleen. Amen. Use them both. The spleen you could use with any tissue. It's the universal, as I say. So this gives you a good picture of how I look at a protocol, how deeply I go in and use these products. So, so I think enough said. I'm going to go back to the protocol here. And if you want any of these things that you've looked at on the screen today, just send me an email. I'll send them all to you. My purpose of getting this book out is to help you go deeper with your clients. So,
Joseph,
yes.
what was the name of what you just had up on the screen? What do you call that? With the Orchex and so forth. What?
Oh, that's just from my, just put in your email, just put the Orchex. And
okay.
or hyaluronidase if you can, or put spreading enzyme. That's easier to spell.
Spreading enzyme. Okay, thank you.
Because I put this together just for, I just extracted it, cut and pasted out of my larger. I don't need to send you the whole advanced training.
No, okay, thank you. People are asking in the chat box. Thank you.
Okay. So any other questions?
Yes, Joseph, Steve Pena. I had a
Hey.
question regarding if you considered using Rheumaplex as part of the protocol.
Yeah, I was asked that last week about Ostraplex. And so those formulations were made after Lee passed. They're not Lee formulas. And there's nothing wrong with them, but they are so watered down, they're so diffused, you are not going to get the clinical effect that you want. Now, let me just read so I can just show you this. You're not going to do it with one product. It's just not going to happen because you have to address all of the different factors that I reviewed with you. And here it is. Rheumaplex has Catalin, Ostrophin, Calcifood, Arginex, calcium lactate, Prostac, brewer's yeast, and Betacol. There's nothing wrong with any of them, but you'd have to take 50 a day, 30 to 50 a day to get anywhere near a clinical. So I don't use those. I've tried them and I have not been successful with them, not to my satisfaction. So certainly, listen, I'm not the be all and end all. Try it. Let us know if it works. Or try it in combination with some of these others. But applying the specific products in the needed dosage is the key to getting this monster under control. And this is a monster.
Thank you.
Yeah.
Joseph,
Any,
it's Lynn. There's
yeah.
2 other questions in the chat box when you're ready.
Go ahead. Sure.
If person has no cartilage in the joint, can Calcifood rebuild it, or is something else better?
Well, yes, over time. Now, to the extent that when they were 20 years old, no. But it can. But this is, you're talking years. Or it can keep whatever cartilage is left, at least keep it where it is. Now, when you get that irritation and that inflammation in any joint, now this more relates to your osteoarthritis. You can, I mentioned this on Thursday, you can have those, they used to be called Rooster comb injections. And that's also in the appendix in my book, I believe. I'm pretty sure I put that in there. And so twice a year, you can get these injections and it just creates basically a synthetic cushion, but it's better than replacing joints and the terrible surgery. The surgery with rheumatoid arthritis, you know what they do is they go in and they scrape out all the synovial. Then you have no fluid in your joints. It's insanity. The medical approach is just, let's cut it, burn it, or poison it. But that's not the answer. So I have, over the years, haven't totally rebuilt joints, but I certainly bursitis, shoulders, yes. Discs, yes. Knees are harder and hips are harder because once you reach the point of the autoimmune phase, the road back is long. It's long. But the road back to a lot of these conditions is long. The road back from cancer is long. Crohn's, MS. Can you do it? Yes. Yes. You know, my niece has MS, and I have to send her 6 bottles at a time of neurotrophin because if she runs out, she immediately begins to decline. So that's how important these are. And I have one other friend that had a brain infection that should be dead. And he says the same thing. So the effect of these, especially the protomorphogen, to remove that burden and keep that burden off is tremendous. You can't do it without it. I don't know of any other way of doing it. But as far as rebuilding, yes, I've had my sister and one other client, just off the top of my head without even thinking, that they have gained, you know, better integrity of their knees especially. Yes. What's the other question?
Okay, and the other question comes from Ellen Jasmer. How does juvenile arthritis relate to these protocols?
Mm-hmm. Ellen, great question. Same principle. Now, depends the age, but the same principle that I just shared. So what you would do is cut these dosages down, way down. And you could use, you know, maybe 1 and 1. Again, you're going to have to find your way with that, the dosage. And Immuplex, open the capsule. You know, the ostrophin, just grind it up. And you don't want to put it in a lot of food, but you could just put it in a little bit, like just a teaspoon. You just don't want to engage hydrochloric acid, because then the body digests this as just a protein. You want this to work, to go in and work clinically. So you don't want it to be interpreted by the body as just a protein to digest and break down. So that's why both of these on an empty stomach, you know, with a teaspoon or a tablespoon of applesauce or yogurt, again, raw milk yogurt, not commercial yogurt. And the same with these. I would do like a half a tablet 3 times a day with the Boswellia. So you want to cut these way down. And you could try the Romania Complex. Again, a half and a half. But the first day, Ellen, just do a half and both of those and see how they do. Give it 3 days on that very low dosage. And again, you would cut this down to a teaspoon. Again, this would be 1 capsule, or this is 1 capsule. This would be, again, a half a tablet, and again, just 1 tablet. So, but yes, the principle in children is the same. Their capacities to work with all of this are much more responsive than you get someone that comes in with 70 years old that's been on steroids and Rituxan and has had surgeries, which I've had them do that. I've had them come in, so.
And
Joseph?
Joseph, there's one final question.
Mm-hmm.
With your experience, what is an approximate time window that you've seen in order to see positive change?
So
sort of positive change?
for every year they've had it, for every year, when did this start? This is the end result. So you have to estimate, if you don't know, when it started. For every year they've had it, you have to give nutrition 3 to 6 months. So pretty much the rest of their life, they're going to be on some of this. So that's how I figure it. 1 year to 6, in this case, 6 months at least. Yep. But even, you know, and I've had this happen with many, even if you bring some comfort into their life, less pain, and you stop the cascade of swelling and breakdown of all of the different tissues in the joint itself, you've done a lot. You've done a lot for that person. So, anything else?
Joseph, I have a question. So did you say that, remind me, C is the vitamin of the triad? The mineral and the vitamin and or was there was other vitamins?
So for the ligaments and tendons and the joint, it would be manganese in the Ligaplex 1, and there's some in Ligaplex 2 in this product. Vitamin E is your question. Vitamin E and pituitrophin. in the simplex F and M.
Thank you.
But certainly, as we looked at the knitting of the collagen, the weaving, and the integrity of the collagen is cataplex C. So I guess you could say, and Lee talked about using C and E together. You don't need high potency E. And
Perfect.
there's enough E. If you take 6 Ligaplex 1 a day, you're getting quite a bit of cataplex E because it's 1/4, it's 25% of the product. There's only 4 products in the Ligaplex 1. And that's what Steve was asking about the Rheumaplex. It's just too watered down to. So, well, great. Thank you all for staying on. I know these which we usually stay on about 3 hours, going over a little bit more. And I'll look forward to being with you on Thursday. Thursday, we're going to look at ligaments, joints, and discs, and review that on Thursday. So thank you all for being on, and I look forward to being with you.
Thank you, Joseph.
Blessings to you all.